Hi everyone, and welcome to today's seminar. Once the poll is up, please take it and let us know what you think the top barrier facing women in global health leadership is. I'm Anna Kalbarczyk. I'm the Assistant Director of the Johns Hopkins Center for Global Health, and I am very excited for you all to be here in today's inaugural session of the Women in Global Health Exploring Non-Academic Careers seminar session. This series is funded in part by the Johns Hopkins Provost PhD Professional Development Initiative and was designed to expose doctoral students to non-academic careers in global health, but even those of you who aren't doctoral students yet or ever are very welcome to attend and join us in these conversations. My colleagues and I also really wanted to add an important lens to this, women's leadership, exploring the challenges that women face in leadership in global health, while also really focusing on solutions that can be developed for institutions and doctoral programs to support women. And so this is why we've sought to develop a more interactive series that incorporates all of your voices as we move through the agenda. So we'll begin with a talk given by Dr. Leslie Mancuso, who I'll introduce in a moment, and then we'll break everyone out into smaller breakout rooms with a Hopkins faculty facilitator who will guide groups through a discussion that focuses on developing strategies based on what you've heard today in the keynote speech. We'll end with a short plenary, a presentation from 1 to 2 groups, but we'll also provide whiteboard space so that teams who aren't getting to share verbally can still record some of their strategies. And our goal throughout this series is really to compile all of the strategies that people discuss, all of the barriers that are mentioned, and try to create some sort of document that we can share more broadly about the lessons learned throughout this seminar. So now I'd like to introduce Dr. Mancuso, who will be giving our talk. She is the president and CEO of Jhpiego, an affiliate of Johns Hopkins University. A nurse and American Academy of Nursing Fellow, Dr. Mancuso is a recognized international business leader with a track record of success in bringing accountability and navigating changes in the international nonprofit world. She has more than 30 years of experience in developing public-private partnerships with organizations such as ExxonMobil, Chevron, Laerdal Medical, GE Foundation, USAID, on and on and on. Dr. Mancuso oversees Jhpiego's long-standing and extensive relationships with international agencies, foreign governments and ministries of health, nursing, midwifery and medical schools, professional associations, and local non-government organizations. She is a passionate advocate for the nursing profession. She received her undergraduate degree in nursing from Southern Connecticut University, a master's degree in nursing from the University of Pennsylvania School of Nursing, a doctoral degree in education and organizational leadership from the University of Pennsylvania, and an executive leadership certificate from the John F. Kennedy School of Government at Harvard University. Today, Dr. Mancuso will be discussing her leadership journey with us and talking about positioning yourself for a future in global health. So please, let's all welcome Dr. Mancuso, and I really hope you enjoy the seminar. Over to you, Leslie.
Thank you so much, Anna, and we can put up just the first basic slide. That would be helpful. Perfect. Well, thank you, everyone, and it's indeed my honor to be here with all of you today in this virtual moment of our time. I'm really excited to have so many talented women online listening to this. I think we have wonderful opportunities, and I hope the little I share today will provide you insight into how to move your careers forward. If you're not familiar with Jhpiego, some of you may be, some of you may not. We're an organization that's worked for the since 1974 to save lives and improve health. We're working to help women and families access health care no matter where they live, no matter what their economic level is. Now, what we do is work side by side with countries, governments, and local partners to help them identify their health challenges, then to build innovative, sustainable solutions, and to take those solutions and implement it with our partners in country. The most important thing, we always say innovations aren't innovations unless those innovations are able to be afforded, are efficient, and able to be handled and taken up by the countries that those innovations are for. So certainly that's an area we work on. I have a staff right now of more than 3,200, the majority of which are in the countries in which we work, and we're working in about 39 countries. And certainly they're working with the most vulnerable women and families around the world. Now, in this position, you know, as the president and CEO of Jhpiego, I've had a front row seat seeing what my staff has been able to do over the years, certainly seeing the challenges and the changing challenges in the health portfolio of countries. They're on the front lines right now as we speak, trying to ensure that essential health services in maternal child health and family planning and HIV and malaria and cervical cancer prevention are continuing, while at the same time trying to mitigate the effects of COVID-19. These same staff have been part of outbreaks before. They were exceedingly active in Liberia and Guinea during the Ebola. They've been active with SARS and Zika, and certainly many other scourges that have taken place around the world. But now, obviously, our focus is how do we continue to help countries moving forward to be able to reach the UN goals that we have for ourselves and help countries reach the goals they have for themselves. No doubt, an important part of my work is observing and working with the many women providers we have. If you think about global health and you think about nurses and midwives and community health workers, many of those are women in and of themselves. And some of those certainly we hope and want to be the up and coming leaders of those countries. We know that nurses and midwives and community health workers are the backbone of the health system. And I can go into that if you have questions about that. But I think there's equally concerns when we look at this. The reason is because there is a gender imbalance when we're looking at women in leadership. If you think about the fact that 70% of 200 million global health workers that are focused on health and the social sector are women, yet only 25% of leadership roles in global health are women. That discrepancy is something that we at Jhpiego, and certainly I as a leader, as a nurse first and foremost, and as a president and CEO, remain very concerned about. This spring, the first State of the World's Nursing Report was released by the World Health Organization. It was developed by Jhpiego alongside the School of Nursing at Johns Hopkins University. And another data point that was loud and clear about gender balance was that data shows out of 191 countries, 90% of all nurses around the world are women. Yet, when it came to leadership positions, they are not getting the leadership positions. There is a glass ceiling for women nurses getting a leadership position, and there has been a glass elevator for men. Those are the things that we're working on, all of us. Now, as a leader, I truly believe leadership is an iterative process. It is a learning process every step of the way. As a leader, I travel about 80% of my time and have been for many, many years. That's the model I'm using so I, as a leader, can meet with the president, the first lady, the minister of health, the government leaders out in the communities. Again, with many decentralized governments, they play powerful positions when it comes to enacting health changes, moving budgets towards the global health arena. So it becomes very important for me to be out there, meeting the women we're helping, meeting the families we're helping, meeting the health providers, the physicians, the nurses, the midwives that are out there, and the community health workers. And in every interaction, I learn. In every trip I take, I learn. And that's an important variable for all of us. Now, I did learn from my mentor that I had, who was at the time the dean of the School of Nursing at the University of Pennsylvania. Her name was Claire Fagan. And at one point she said to me, Leslie, a true leader builds leaders around them. And that's been something that I, as a leader and as a woman leader and as a nurse leader, have taken very seriously, and I think we all need to. I think it's very important that we set the stage and help our colleagues, help other women get into those leadership positions and succeed in those leadership positions. So my presentation today is coming to you as a woman, as the president and CEO of a very large NGO, as an individual that sits on a number of boards consisting of a lot of private sector colleagues and the like, and certainly as somebody that I hope will give you a few ideas of what's gone on in my career. Now, when someone asks, Leslie, highlight some areas, let me put up the first slide. Next, yes, thank you. when someone asks about my trajectory in my career, I had to start to think of themes. And certainly this is one theme. And I know you have the polls in front of you as you're looking at these slides. And it may not be that you can read all the, at least I can't read all the slides. You might be able to read all the slides. But in this picture, you will see, if you could see a little sliver of the picture, you will see me with a community health group. This village, this community I'm in, probably has 500 people there as I'm there. And if you had asked me when I was in college or I was in graduate school, would you be in the middle of this group? Would you be singing and dancing and giving health messages with community health workers and nurses and the like? I would probably have said to you, not in your life, because I had never done anything like that. So let me tell you how I got into where I am. As you heard, I see myself as a nurse first and a president and CEO of Jhpiego second. When I graduated from nursing school, my interest was very clinical based. I wanted to be a clinical nurse, and I did that for a period of time. I worked at Johns Hopkins, I worked at Boston Children's, I worked at Philadelphia Children's, I worked at Hospital University of Penn, and so I worked in those in the neonatal and the pediatric ICU area. And then when I was getting my master's and my PhD, I continued to work to keep my clinical skills up. Well, right at the end, as I was getting my master's degree at Penn, I was asked to go out to dinner with a couple faculty, Laura Heyman and Judy Vesey. And to be honest, I was a little nervous, you know, end of my master's, why are these faculty asking me to go out to dinner? Went out to dinner, and at the end of the dinner, they said, we really want you to be on the faculty. And I said, no. No, I didn't say no. I said, gosh, that's something I had never thought of. I really wasn't interested in teaching. They said, we think you would be a great faculty member. You'd be a great educator. We will help you, but we really feel this is an area that you would excel. You have to understand, my interest was to be a clinical nurse specialist at the Children's Hospital. That's where my path was. That's what I was driven towards. And I have to say that in many ways, I didn't want to veer off that path. I had had a path to be a nurse since I was young. This was the path I was on. I went home that night, spoke to my family, and over the next couple nights, and I was very upset. I laugh about it now. I was very upset about this offer because it was so anti what I planned to do with my career. In the end, I did take the position, and it was the best decision I ever took for a variety of reasons. I loved teaching. I learned how to teach. I learned about education, and I loved it. I love teaching undergrads, master's students, and doctoral students. I love the innovation, the evidence-based, the research going on with the faculty. I love the exchange of new ideas. So I loved everything about it. And if I hadn't made that decision, I'm not sure where my career would be now. Well, while I was teaching at Penn, an NGO came to me, Project Hope, and they were sending a team down to Costa Rica. Now, again, this is many years ago, before it became a resort, down to Costa Rica to look at critical care needs. And they asked me if I would go. And so I went, finding out then that I was the only nurse going and the only woman going, and we looked at critical care needs. Now, you have to understand, I grew up in a little town in north of Connecticut, in a border between Connecticut and Massachusetts. I had never even been to Florida, no matter going to Costa Rica. But I must tell you, that experience, I am so glad my friends said, do it, and my instinct on it was, do it. After that, I went to many countries. I went to Nicaragua during the war. I went to Poland, at different experiences, some short, some a little longer. I went to Poland under martial law and worked with the Krakow Children's Hospital. I took a semester off and went to Indonesia and set up a dengue unit for children who are critically ill from dengue. I went and spent the summer in Zhejiang Medical University in China and set up a neonatal education training program, the first in the country. And in each of those experiences I learned, and what I learned and saw was all these women and children that were dying needlessly that didn't need to be dying needlessly. And to be honest with you, that's where my passion developed. It developed from a time of seeing the realities of going from the United States into these situations and watching a mother whose child was bleeding in a dengue unit, and she had to figure out how to get the money available to go to the pharmacy, to buy the supplies, to bring them back to the ICU so they could in fact use them on that child. The realities of the economics that play into healthcare and global health were really startling to me. And it was there I built my passion and decided that I needed to do it. Now, those are examples. I'm going to give you one more example of where I did something, but I didn't plan it. In the midst of different lectures and different exposures, I was invited by this woman to join APEC. Now, some of you are sitting there going, APEC, and you're all looking it up on your Google. I didn't know what APEC was. And I'm thinking, and she said there's a Life Science Innovation Forum board in APEC. So I looked up APEC, it's Asia Pacific Economic Cooperation, and it's the 21 economies that border the Pacific Rim. So you have, developed countries and low-income countries all at the same time working together. They began focusing on trade, but started looking at health and its impact on economics. I ended up taking and going on that board. And again, it was not a good time for me to go on the board. I was busy with Jhpiego. I had a lot I wanted to do, but I have made more networks, more connections, and learned so much from these innovative people that are on the board. It's made up of a lot of private sector, a lot of companies. It's made up of university deans, university researchers. It's made of NGOs, and it's made of government leaders. At one point, I might be sitting with the ministers of health of all the countries. At another point, I might be sitting with the CEOs and the leaders of the countries. And so in different ways, I've been able to interact and bring that experience back to Jhpiego as a leader, and at the same time, bring what Jhpiego does out to there. They were really looking at cervical cancer in the whole Pacific Rim and trying to figure out how to kickstart, prevention activities and immunization activities. And I was able to facilitate these discussions between 15 countries that I probably wouldn't have had that opportunity if not for joining that board. So number one, always take advantage of unexpected opportunities and don't keep yourself so rigid that you don't move off that. Okay, next slide. Now that you've found your passion, once your foot is in the door, prepare to take your seat at the table. What do I mean by that? As your career unfolds, you can't be the expert in everything, but you can learn from others. And one thing I want to say to all of you is, don't just stay in the global health bubble. You have to get outside that bubble. And even with being on the APEC board, I've learned a lot about economics. I've learned about GDP and the influence of women's health on GDP. Areas that perhaps I would not have been talking about as much if not for having these opportunities. It also brings new ideas that you might not have if you stay in the global health bubble and don't get out to other meetings and other networks. I told you I was inspired by my travel. At this time, I began to realize as I was in global health that I really needed to look at learning the business, I say. It's one thing to go out for 5 months, 4 months, 2 weeks here, 2 weeks there. But I really felt that I wasn't learning the business. I wasn't understanding the business. And that's when I realized I needed to move on from my position at the University of Penn. So after being on the faculty 8 years, I then went to Project Hope. An NGO, again, all NGOs are not the same. We all have different missions. You have to look into what our missions are. But certainly I went to Project Hope. And I started as a deputy to the director of nursing. Within 8 months or so, moved into the deputy to the vice president, then the vice president, then the chief operating officer, and then the acting CEO. And in that time, I would say the last 4 positions I held were never held by women. And the last 2 positions were never held by a non-family member, because Project Hope was founded by the Walsh family, and typically the Walshes had always been at the helm of this organization. But I learned as well while I was moving up that I needed to stay true to why I moved to Project Help, and that was to learn the business. So I spent a great deal of time with auditors, with finance people. Not to say I was the expert in all of it, but I needed to understand compliance issues. And certainly as an NGO, you must understand the urgency of maintaining good compliance. I needed to understand finance. I needed to understand human resources. Again, not to be the expert on all aspects of human resource, but to understand the importance of it and the dimensions of it. I needed to understand fundraising and individual giving and what components went into that. And so I studied the business so that I could move up in leadership positions as I. You see, as a woman, I didn't want to give anyone any excuse not to promote me and not to become the leader that I wanted to be. Then, as you heard, I continued to go on and went to the Kennedy School, again, in a program that was attended by mostly people coming in from the for-profit sector, from businesses and other avenues. There were not many people that came in from the nonprofit sector. In fact, I didn't meet any during my sessions. I'm sure there were some there. But again, it got me out of my bubble and got me into thinking different ways. What are other people doing with finance? What are other people doing with supply chain? And made me look at things a little differently and opened my eyes as a leader. So the important thing to me is that you have to believe you need a seat at the table, and you have to make sure you get that seat at the table. But it first means you've got to prepare yourself. It's of no use for us to have a seat at the table if we're not prepared for that table. And so it was important to me that I was prepared to sit at that table. I had learned over those decades. I continue to learn in every visit I make, in every exchange I have. And I prepare myself to have a seat at any table I'm put at. And we're going to talk a little bit more about that in a little bit. Let's go on to the next slide. The next slide talks about another piece of advice, and that says, get comfortable with being uncomfortable. Now, I know you're all wondering, okay, Leslie, what do you mean by this? Well, whatever your dreams of a career, it's very important that you as a woman and as a leader find your voice and use it, because you may be the only woman in the room. Now, I'm sad to say that this is still the case in many aspects, or you may be one of the few women in the room. When I joined Jhpiego, there were very few, maybe one other woman in leadership in NGOs. Most of my competitors, in fact, I would say 99% of my competitors, their organizations were led by men, and men that were either a physician or had Peace Corps experience typically. So it was a rarity when I came into Jhpiego to be a woman leader. And I must say that, you know, even coming into Jhpiego, it had existed for 30 years before I came. It was led by men, it was led by physicians for all those 30 years. And so it was truly an honor to come in with new ideas and new ways to look at things. But you have to be comfortable with being uncomfortable, because you may be the only woman in the room. Now, this has held firm as well for the boards I've been on early on. Joining the World Trade Center board when I first came to Jhpiego, first it was one of those avenues that, why would I join the World Trade Center board? It's all corporations, interested in international work. But it was an incredible group, and I'm still on that board, and it's an incredible group of leaders, CEOs from the leading companies in Maryland that are doing international work. You get a lot out of those exchanges as a board member, and it puts me front and center to talk to them about what's happening in my world. And in all honesty, they always want to know, and that's wonderful for Jhpiego, and it's wonderful certainly for me. And that has happened in every board I've been on, where typically I was the first woman on the World Trade Center board. I was one of a few women on the US ASEAN board. Now, that's not to say these boards have now worked very hard to diversify their boards, but it's still to say quite often you will always be in a minority, and you have to be comfortable with that. You have to have your own voice, and you have to know when, how to use your knowledge, your skills, your talents, and put that out. Now, at the same time, this picture is a classic picture of my exchanges in many countries. In countries, women that are not moving up the ladder as fast as men. Men typically are leading in these countries. Now, that's not to say we have a woman minister of health in Tanzania, a woman minister of health in Rwanda, but it is to say in many meetings, this is very typical of my exchanges. And in fact, for a number of experiences, I would go, my vice president is to my, if you look at that picture to my left of me, that's a vice president, Dr. Alon Damiba. He and I would go into meetings, and if they've never met me, they would assume he was the president and CEO and that I was his assistant. And I've had incredible men over my career that always wanted to make a point of saying, you know, if I were you, I would be talking to her because she's the leader. But again, you have to be very comfortable in putting your hand out there saying, I'm Dr. Leslie Mancuso. It's very nice to meet you, and move on with the topics you do. Oftentimes, unfortunately, this pattern of women not rising to the top of leadership positions is there, and we have a lot of work to do around gender to change that, and other issues to change that. You have to learn to be comfortable in this kind of state, and you have to learn that we are changing this, but it's not changing quickly enough. How do you work at getting comfortable being uncomfortable? You have to know your self-worth in that meeting. I have to know what my goals for that meeting are, what I'm bringing to the table in that meeting, the kind of dialogue I want to have in that meeting, so I can move that agenda along. And you're going to use your different skill sets depending on the group and the group of men that you might be in that meeting with. But that, you know, it's very important for you to recognize that, I see it, but I'm working towards my goal. I've got my goal in that meeting of what I wanted to do with those gentlemen that day. We were building a partnership. We were talking about our work together, and I needed to make sure about that. And, you know, there's many examples I could use about how Jhpiego continues to work to ensure that our nurses, our midwives have equal opportunities in our organizations as our male, either physicians or managers or the like. Now, again, there are many women physicians on our team as well, so let me clarify that as well. But we have about 1,000 nurses and midwives out of 3,200 staff. So in that, I need to make sure that they have the same skill sets, that they can publish, that they can be in any position in our organization, whether it's being a country director or it's being a vice president or it's being certainly replacing me. And we also need to make sure that we are making sure people are part of boards if at all possible. Now, again, I told you earlier, you need to make sure you develop yourself to get a seat at the table. I have used this phrase in a number of talks, and I started using it in Southern Africa, where I met many nurses and community health workers and midwives that were saying to me, you know, I feel bad, I'm never part of decision making, even though I do, 80% of the global health services are provided by us, I'm never part of the decision making. And I said to them, if you don't have a seat at the table, bring your own chair. And I mean that very sincerely. There are times where you have to maneuver, where I had to maneuver to get myself at that table where decision making was going on. And it's very important that you figure out how to get that chair and you figure out how to maneuver, but you have to have the skill sets to be at that table in order to do that, because you want to bring the best of your experience to that table when you do that. Next slide. So then another thought, I gave a talk a little while back, and someone said to me, Leslie, you've grown, your organization has grown, and how do you keep a culture with the changing organization? Now, as I said to you, we're an organization that was formed with values. We were formed to ensure that women and children, no matter where they live, no matter what their economic level is, had access to life-saving care. We hold tightly to that vision. And even though the funding changes, donors' interests change, countries change, we have to work and make sure, and I as the leader have to work and make sure we drive towards that vision. We drive towards reaching what our mission is. Since my arrival at Jhpiego in 2002, our organization has grown from a $5 million organization to as high as a $400 million organization. We've grown from 4 programs to as high as 140 programs. I've had 189 staff. I've had as high as 4,000 staff. And in that, I, as a leader, has a responsibility to make sure that we as an organization kept ourselves focused on what our values are. We pride ourselves in quality and bringing in evidence-based practice. It is of no use to me as the leader to grow an organization if we're not going to have our quality and we're not going to bring evidence-based practice and the best of technical leadership to the situation. I would rather remain small. So a lot of our work was working together with our teams around the world and ensuring that we talked about what's important, what do we expect out of our programs. A lot of us have to change our programming as could be expected because of the changing landscape in countries. You know, countries are no longer, countries that we'd worked with for so long in maternal child health are now dealing with non-communicable diseases, heart disease, diabetes. We're working and looking at immunizations like the HPV vaccine. We're looking at a lot of areas that countries are grappling with, and we're having to readjust ourselves. But in doing that, we stay firm to making sure whatever we do is done in a quality way, is done evidence-based, is done bringing the best of technical leadership, and most importantly, is bringing solutions that the country builds with us, adopts with us, and moves these solutions forward. Our success is always around a country's ability to take on this program and move this program forward. And not just the program, the policies, the standards, everything we develop, you want them to own it. So in the pictures you see earlier where I'm with individuals, a lot of times my meetings with them are about talking to the Minister of Health. As a minister might be thanking me, I thank them. And I say, this is your program. And so in that sense, it's not Jhpiego's program. It's your program. We're helping you to take this information and adopt it in the best way possible in your country and own it. The best thing for us is when a country talks about their new initiative and it's theirs, and it's Jhpiego simply helping them to do what they do best. And so if they're owning it to us, that's a success. If they're self-reliant, that's a success. If they have healthy families, that's a success. And that's what our goals and our mission focuses on, no matter what size we are, no matter how big my staff is. So you have to, as a leader, hold on to those core values, help your staff hold on to those core values, and even in your own individual, hold on to your core values of what's important for you as a leader, what's important for you in saving lives, what's important for you in helping these countries to help themselves. That's all about it. So now I'm going to conclude. There is, you know, knowing that we right now have 251 participants in this is extraordinary to me. My goal with all of you is that we work together to figure out this gender imbalance, to make sure women are moving into leadership positions with the knowledge and the skills and the abilities as leaders to take on these new assignments. For our part, Jhpiego's working internally in our countries, in our organization. Last year, for the, I think, second or third year in a row, Global Health 50/50 out of the UK. It's an organization that evaluates for-profits, not-for-profits, multilateral organizations, and looks at gender equality. For, you know, the second or third year in a row, we came out as a high performer when it came to gender equality, the policies we have in place, and our workplace diversity. And that's something, again, going back to core values, has really been important. We take this philosophy wherever we go. I make sure people know wherever I'm speaking that I'm a nurse first. I make sure people know that I'm the president and CEO of Jhpiego. I make sure people see, you know, other women see that women can move into executive positions, whether it's on boards, whether it's in a situation like, you know, being the head of an NGO or the like. We also at Jhpiego are launching, and just did last week, the Gender Transformative Leadership Curriculum. This is for health workers, and it was built on all the data we collected from Tanzania and Ethiopia and Liberia, from nurses, from midwives, from health workers, women health workers, and what was happening to them. And we're hoping that this transformative literature and this work will help us look at things around determinants of career advancement and communication and mentorship opportunities and the like. You see, I believe that global health is important, and it will only succeed. We will only move countries forward if women are part of those solutions, if women are in leadership positions and able to contribute the most of what they have to that country, to the world at large. And so our goal, obviously, is not to lose female talent, but to gain female talent, to get their perspectives, to get their knowledge, and bring it to the table. And in that, I want to thank all of you today for being part of this. I haven't been able to see the chat box. I see it's very active, but I haven't been able to read it. But I am going to take questions and answers. And as Anna said, I don't know if I've gone over time, but Anna.
No, you're fine. You're fine. You did wonderfully. Everyone, a round of applause for Dr. Mancuso. Thank you for such an exciting talk. And we've got some really fantastic questions lined up.
Okay, perfect.
And we've shared the results from the polls. And I promise I didn't even plant the poll results or the questions. But what we're seeing in the polls is that people are saying the top barrier for women in global health is a lack of mentorship. And one thing that you talked about in your talk was both mentorship, but also something that I've learned to call sponsorship, right? So in my mind, that's really someone saying, you should talk to her, right? You described that, like men in the room saying, I'm not the leader, she's the leader. And I think mentorship and sponsorship are both, they're two different things, but they are of a piece. Right. So a number of attendees would like you to talk a little bit more about the role that mentorship has played, both for you, how you work as a mentor, and really, I guess, how people can utilize mentorship to find careers and to grow their leadership path. Sure.
Well, let me say, I learned from not having many women mentors because there weren't any, I remember going to I'm not even going to tell you the umbrella organization, but I went to this umbrella organization meeting and the men were over here and, I was a woman CEO and I come in and there was maybe one other woman there. Now this has changed since then. In the last 5 years, maybe it's changed, but we didn't have that. And so my commitment has been to make sure that I am there. I spend a lot of time, people refer women to me, whether it's women students that are trying to figure out in the global arena what they want to do, or it's women that have been in a certain career and want to change to another career and are looking at global health as that other career, or it's dilemmas they're dealing with as trying to move up in the organization and what they can do. And so I do think that we as women leaders have a responsibility to be there for others. My goal, as Claire Fagan told me to do, is leaders build leaders around them. My responsibility is to make sure I'm helping other leaders, other women get to that point of being, think about it. When I came in, all the organizations that deal with family planning, maternal child health that you can think of, Save the Children, FHI, MSH, JSI, what other ones? Pathfinder, all were led by men for many years, many years. And, I think that we have an opportunity to be able to speak to that now and now there are many more women, but it takes us making sure that we're helping to mentor people with that. So I myself mentor. I mentor when I'm out in the field. I think part of my responsibility is not just helping my staff, but modeling for my staff about what I need to be, what I do in meetings, how I interact with the men in meetings, how I try to steer towards our ultimate goal and drive the agenda, how I drive a partnership and create partnerships together. I try to help and make sure, a lot of times when you have events, nurses are not invited, midwives are not invited, other women are not invited. I ask for the invites, because I'm a guest, they'll let me invite others. And so for the first time, some of these women that are leading these clinics, that are running these clinics out in the community, are getting to come to an event and interchange with others that they would never have been able to interchange with. So there's many examples where I feel, particularly in the field, I'm working to get women in those positions. At the same time, I started with the World Trade Center, a women's executive program many years back, 10 years back. And it's a one-day event bringing women executives from the state of Maryland together for women who are up and coming. And so I bring 10 women from our organization to that every year so that they themselves can learn from women experts. And they're of all different companies. Some have founded their companies, some are part of NGOs. It's a lot of for-profit, the sector, and it's great exposure. There's another group that I work with that again has opportunities where our women staff can go to those events. And again, I'm also looking at how I help and model for the men in our organization so that they see the strength. And I'm very fortunate. The men in our organization obviously believe in women's health, the role women play. If women are healthy, their countries are healthy. So they start out with that belief and they start out with that commitment, but it's helping them as well figure out how to ensure that women have equal opportunities in the organization. And that's a work in progress for every organization. And to me, that's part of what my job is. That's a long-winded answer.
It was a good one, though, and it also gave time for a lot more questions to come in. Okay. One of our first questions, and I think it's very relevant, I mean, it's relevant for global health, but also relevant in today's climate. Yeah. What is your advice for women working in hierarchical and gendered settings? And similarly, as we think about women of color, what additional challenges might they face in some of this leadership journey, and advice that you might have for them?
Sure. Well, that's very concerning. I mean, obviously, women of color, Black women, Hispanic women are probably having even more challenging times moving in. And I think, again, it's number one, a responsibility of all of us that are in positions that can influence this to ensure that we are recommending these women, that we are getting them positioned. I'm not saying we all do everything perfect, but we have to step back sometimes at leaders and say, am I doing everything I need to be doing to make sure that these women are getting an equal opportunity as a white woman there when they both have the same credentials and background? And, we've worked hard on diversity, but we will continue to work on diversity. When I came to Jhpiego, 90% of our staff was in Baltimore. Now, 92% of our staff is in the field. Our field staff are led by people from within their own countries. We've worked hard to diversify our leadership team, and it goes on. It's a work in progress. But I think, when it comes to being in an I've been in many situations where you're in an organization or you're on a board that is male dominated and you have to maneuver. And I have to say, I use the word maneuvering very honestly. I have to use my skills and talent, and I have to figure out what my end goal is and how I'm going to work to get to that end goal. And there's lots of ways to get to an end goal. It depends on who you're working with. But it starts with you believing you have worth and belong at that table. If they sense in any way that you are questioning your skill set, questioning your knowledge, questioning your background, then you won't be able to maneuver and get to what your ultimate goal is in that meeting. So first and foremost, you got to go in knowing you've got the skills. You got to go in saying, I belong here more than they belong here. And so I have something to offer, and I'm going to figure out how to get those points in. And there's lots of different ways I've had to use to get those points in.
But I also think, earlier you talked about how you leveraged all of these opportunities to learn so much. And there have been questions about how you gain skills, but I think I'm going to pass over them a little bit because you talked about it's about embracing every opportunity to bolster every skill. And I also really appreciated, you said we're not all experts in everything, but you have room to learn and to take in from what other people are telling you, and that's important in moving forward.
Was it fun at times sitting at night with an auditor and trying to help him teach me a P&L sheet? Was it fun, at night saying to the CFO, hey, I want an hour each night for a while for you to go through in depth with me a little bit more about finance, because I didn't get that in nursing school. I didn't get that at the University of Penn as faculty. And you know what? you got to take those opportunities. If you're in a working environment and you're working with people, sit with them and ask them some questions and start to dig. But you know, part of it's on you. It may not be a formal education, it may be informal, but take the opportunities to learn. I ask a million questions still to this day because I'm trying to learn. I'm trying to take us to the next level, and I got to keep learning. I can't be stagnant.
So I think I've got two big buckets of questions that are coming through that I want to ask. And the first one is going to be around the role of different types of degrees. So there are a number of people who said, you know, honestly, they think their biggest barrier is having a nursing degree, not being a woman, right? They're at the seat trying to deal with doctors. I think some people were also asking, you know, as you think about master's versus doctoral, because part of this is about, like, you know, exploring careers as doctoral students, but what might that mean for master's students? And then I think also thinking about resources for how people with different types of degrees can find jobs in leadership positions. And then I'll move to the second and last bucket.
Tell me your first point on that. I got the doctoral. What's your point?
Right, so that was really about, like, if you have a nursing degree versus yeah.
Well, let me just say, I'm very sad when I hear people say, I have a nursing degree and, you know, is that a good thing? You know, when I get introduced overseas, they always introduce me as Dr. Leslie Mancuso. And then I say, I am a nurse before I even start speaking at the podium. Oftentimes I tell the person that's introducing me to please say I'm a nurse. And I look out in the room and there might be a smattering of nurses, midwives, female doctors who all smile. And there's a reason for that, because, you know, you should not feel because you are a nurse. We know so much about healthcare. I mean, let's look at what people are talking about. Let's look at what the nurses are doing now, the triage systems they're building during COVID, the system of patient care they're having to create in our hospitals. That's being done by nurses alongside their physician colleagues. But nurses are playing a vital role in that. We know healthcare, and we should be proud of, whether we're physicians should be proud of being physicians, and we as nurses should be part of being a nurse. We should be proud of being part of the team. I always say to them, we need to be shoulder to shoulder with our colleagues, no matter what their gender is, no matter what their degree is, no matter what their salary is. But we need to be equal partners. We need to level this playing field that exists out there. But it comes with you not ever questioning your nursing degree, but believing you know a lot that needs to be done. Now, regarding master's and doctoral, I will tell you a quick story. I had gone to Practico without my PhD. I was all but dissertation. And, you know, it's really hard. They always tell you not to do it. And I would tell you not to do it, but I did it. And I was really narrowing the time whether I should complete it or not complete it. And I was working with my board. I was a master's degree. I was, you know, I was working with the board as a COO. I was working with the board as the acting CEO. Well, I finally decided I was going to finish my PhD, and I finished it. I come into the next board meeting. They had always called me Leslie, okay? I come into the next board meeting and they go, Dr. Mancuso. I still laugh at it. And it was the president and CEO of GlaxoSmithKline. My whole board was private sector. And he said, Charlie said, Dr. Mancuso. I said, Charlie, you know, yesterday you called me Leslie. And he goes, oh, but now you have a PhD. So I do feel, I mean, I did complete it because I felt like they were going to use that. I was trying to give people no excuse not to promote me, not to put me in a leadership position. I don't know if I would have gotten Jhpiego's position without a PhD. You know, they typically had men and they were physicians, but I don't know without the PhD whether I would have, I don't know. I could have, but I don't know that. But I think a doctoral degree brought me a different level of analysis, a different level of looking at things. It brought me relationships with these incredible colleagues around the world. And, you know, so I feel like it was really important for me, given that I wanted to be a president and CEO. At the same time, we work with a lot of master's prepared, public health, and we have, you know, Jhpiego has many public health experts. You know, I have staff that are made up of all different type of expertise. And And they bring a great deal to the table. Our public health experts bring an enormous amount to the table, particularly as it relates to looking at situations, to measuring situations, to looking at impact, to helping us look at things from a public health lens. So having a master's, is you have to figure out where you want to go in your career. And I think that will help you dictate. But don't short sight yourself with getting a doctoral degree. It was really important for me, and I'm so glad I finished it. And the last is resources. There's no doubt this is, people, my daughter who went to doctoral school couldn't work when she went to doctoral school. When in my era, you had to work, because you couldn't afford it. And so I worked full-time night shift and then went to school full-time days to get through, my master's. And so, you have to, it is hard finding the resources, and I'm right there with you. I didn't grow up having resources. I took out a lot of school loans. I paid them all off finally. It took a while, many years. But, people always assume, oh, Leslie, she probably I grew up in a small farm town in northern Connecticut. I didn't have the resources either. And it's figuring out what employers support education, ways you can do your education, ways you could do night shift while you're doing it. It's a short window of time. So, those 2 years I did that, now I look back, it was pretty hard then, but I look back and go, hey, I got my master's degree, Okay, now another bucket.
Yeah, all right. So then the next bucket, which I actually think ties in perfectly with what you were just talking about, is really about balance in global health careers. Yeah. So, which I don't even know who has it, but it's, how do you build a career in global health? You talk about international travel, being on the ground, meeting with people, that is such a huge time. And then having balance with life and family. So that came up quite a bit. So any suggestions there?
Yeah, my failure is not having a good balance. I'm the first to tell you, people would tell you that. In fact, during COVID, this is the most time I've ever spent with my husband, who I've been together with almost 30 years. I've never been a solid 4 weeks with my husband. And now I've been a solid, 8 weeks with my husband? It's been lovely, by the way. But
I was about to say, how's that going?
But I will say, number one, balance is not, it's an inappropriate word because what you have to figure out is what works in your relationship. I happen to have a husband that really supported and understood when he met me how important my travel was, how important it was to me as a leader, how that's what drives my leadership, is understanding my staff here in Baltimore and Washington and my staff in the field, and understanding what they care about, what they're upset about, what works, what doesn't work. So that was important to me and drove me, and he understood that. And therefore, that's how our relationship worked. But I won't say, if it wasn't for him and being able to handle a lot of the household things and a lot of the decision-making things that perhaps I wasn't in the country for, it's extraordinary. But balance, I do worry very much about women, and I think we have to be advocating more. And we learned this with the nursing report we worked on. There has to be a look at creating an enabling environment for women that are working. There has to be. And we saw that in the data with nursing. We have to look at work schedules and ways to adapt schedules for women in the workplace, because they are doing a multitude of jobs. As we have to look at sexual harassment and violence against women. All those issues have to be looked at, but certainly that balance is something we have to be talking about. And I have to be aware of it. I worry about it with my own team. I worry about their travel. I know they have young children. They're trying to juggle breastfeeding, a new baby, trying to manage. It's hard, and I worry. And we've tried, and we continue to look for ways to be able to support that. But global health work is demanding, and so it takes all of us, and I hope we continue to learn new ideas of how to help. Maybe it's not a 50% balance, so help women be able to speak to what they need in the workplace, and help us continue to figure out within the structures we're in how best to maneuver to help women to be able to work and have a home life.
Absolutely. Well, now that you've talked about enabling environments, that'll move us perfectly to our next section. So thank you so much for your talk and for that wonderful Q&A. What we'd like to do next, for those of you who are willing to stay on, I think this will be a really exciting feature, is we're going to break out people into different breakouts, and it'll be about 20-ish people based on how many we have here. And each breakout room will have a facilitator who's been given a guide of guiding questions to discuss. And I really want groups to focus on strategies. So not so much discussing the challenges, which I think we've done a lot of today and have been done in other spaces, but really strategies for institutions to support women leaders. You could also think about doctoral programs, how they might support women leaders in global health, or help to further women to pursue non-academic careers in global health. And then also think about institutional support that you might need to touch on each of the 4 things that Dr. Mancuso discussed today. How do you take advantage of unexpected opportunities, help prepare to take a seat at a table, get comfortable with being uncomfortable, and hold on to your values? Each facilitator will briefly introduce themselves. I think we don't have enough time for everyone in the room to introduce themselves, but you can certainly share contact information. I recommend using the whiteboard feature so that those who aren't talking can still write on the whiteboard, and then the facilitators will take notes. I'll have Megan bring us all back so that we at least have a few more minutes to come back together as a group at the very end of the session and finalize. So with that, I'll ask Megan to take us each to our small breakout rooms, and we'll see you there. Thanks again, Dr. Mancuso. That was a wonderful talk.
Thank you so much, Anna.
Thanks. All right, hi everyone, welcome back. Thank you so much for engaging in your small group sessions. I'm just going to share my screen again very quickly, and then we'll take our last 15 minutes to wrap up. And I'm hoping, can everybody see my slideshow? I'm just going to assume yes. Thank you. Okay, so I want to have, within these last couple of minutes, maybe just one or two groups have the facilitator report back, maybe a couple of key points of discussion, maybe some strategies. And then for those of you who aren't talking, I'm going to allow annotation on this slide. So if you want, you can type a statement on the slide to just outline what you talked about, so that that gets on the board as well. And then I'll end in a few minutes with just some closing statements and some next steps. So I think I've asked Dr. Anastasia Lambrou to talk, and then we'll see what other volunteers we get. Maybe Yuka or Caitlin, but go ahead, Anastasia.
Yeah, we had some really great conversations and some innovative ideas of things that we can employ today or even next week. So I think our first point was around mentorship and solutions. And an idea our group came up with that I think would be really great, and even through this series, is to create these roundtables, so virtual roundtables with women in global health around the world, also highlighting different careers and different educational paths as well, and dedicating that space. Another one was connecting women in global health that can be mentors to one another in different levels, and creating social media groups, so WhatsApp, Slack. And I think we saw this in the chat box earlier, but we all discussed today that we would love to be part of a group like that, talking about all the different types of educational barriers, social barriers, cultural barriers. And then the last points in our group were about kind of culture and the institution itself and policies that help support these different ways that we can have working lives and support all of our different passions, whether that be maternity, paternity leave, policies at the institutional level, or also just normalizing and destigmatizing, talking about family, time, marriage, children, and creating these spaces for one another. So those are kind of our major highlights in our group, was connecting, culture, and policies.
That's great. And the Slack channel is already on the Center for Global Health to-do list. We're probably working on it as we speak. How about you, Dr. Sarah Bennett? Would you share some findings from your group? Oh, you're still muted.
Yeah. Thank you very much, Anna. So I think there were a few things that came through. First of all, we were all struck by how many people were on this call, and we felt that it really reflected a need in the community to have more spaces and more opportunities to reflect on women in global health. There's clearly a lot of people interested in this. So could we create more networking opportunities so we could connect with each other better? Could we create more forums where women could discuss some of the challenges they face and how they're going about addressing them? One of the colleagues in our group reflected on the society or the organization Women in Global Health, and reflected that maybe we should be working more with that organization as well, which seemed like a good idea, and perhaps even sort of setting up a local chapter of Women in Global Health. We talked a little bit about mentorship and recognizing how important that is, but also some of the challenges in terms of finding a mentor. Sometimes it works well when you have an advisor that you can select, but other times it's harder to find a good female mentor. And we wondered about more formalized mentoring programs, potentially including alumni from across the university to support that. So I think that those were some of the highlights of what we had said, but overall a big demand for more opportunities to interact with each other. And if the Center for Global Health can take the lead on some of that, that would be fantastic.
Great, thank you so much for sharing. Caitlin Kennedy.
Sure, so in addition to a few of the things you've already touched on, our group talked at the more institutional level about institutional missions, visions, and values, which may sound dry and boring, but often can both be a way for individuals within that organization to point to the mission, vision, and values, to argue for different paths forward, and also that sometimes those translate into metrics that are measured, and so can have an impact. So if we're monitoring what we're paying attention to, what gets counted counts, kind of thing. And then we also talked about structured ways into different career paths we talked about a bit about mentorship and the roles at which individuals can support folks below them, but also just the fact that global health is so diverse and thinking about the diversity of potential pathways and careers and how do you get into those, how do you learn about them, and also the fact that it's a shifting field in many ways, so that the career path that someone took 20 or 30 years ago might not look like the career path someone takes today. And just the role for sort of different institutions to create structured internships or ways to get a job, or even just talking about what the opportunities are, could be helpful for leveling the playing field a bit more, so that we don't always have to say, go network with people, go talk with people, find a mentor, because
Right.
it's not always easy to do.
No, it can be a little bit nebulous. Yuka, can I call on you next? Dr. Yuka Manabe.
Sure. So I think that a lot of the topics that we touched on are here. Everybody was looking for more mentorship opportunities. So perhaps a facilitated or structured way to go across school. So if you're in the School of Nursing, for example, it may be very difficult for you to find somebody in the School of Medicine or in the School of Public Health. School of Public Health being a little bit easier at School of Nursing, because I think that there's a lot of courses that are shared. But, you know, making a cold call or just a cold email to somebody asking for help is maybe not the easiest thing to do. Another thing that came up, which is maybe not a strategy for how to fix it, but that I thought was interesting and worthy of maybe a deeper dive, was that a lot of the younger women are still dealing with work-life balance themselves, and finding room to also do mentorship and sponsorship sometimes is more difficult. And so thinking about how to find women role models, even amongst those who are younger, or coming up with group mentorship or peer mentorship models that would allow some of the areas where you need some help to be covered, rather than on a one-on-one relationship where maybe a lot of women would be quite busy. So a problem and maybe a potential solution.
Thank you, Yuka. I'll do maybe Bhakti Hansoti, Dr. Bhakti Hansoti next, and then maybe we'll end with Leslie again.
Hi, so I think a lot of great things I've already mentioned. The two additional things were like changing institutional culture. So, you know, decreasing manels, addressing male and female faculty the same way, but also the inequity in the promotion tracks. So the staff scientist track versus tenure professorial tracks, and the difficulty in transitioning from one to the other. The second big thing that came up for us was this idea about supporting mentors. So, you know, a lot of people already commented that women do more mentorship than men already. It is on your own time and dime. And so administrative support to fill out all the forms for the credits, etc., but also like buy down to be able to like focus on actually supporting being effective mentors.
Thanks, Bhakti. Did any of the groups talk a little bit more about promoting, like finding non-academic careers? So not only through mentorship, but other approaches, and how institutions might be able to support that. We talked a little bit about that in mine, but wondering if other groups discussed it.
Hi, Anna, this is Nancy Glass.
Hi, Nancy.
Hey, we were lucky to have a member in our group that worked after leaving her MPH, works for a nonprofit outside of the academic setting, and really talked about, you know, didn't have mentorship to help her think about that, but then inviting her back to talk to students, inviting people like we've done with Dr. Mancuso to have people come in and start that network, to have people have opportunities to see people outside the academic network and how they're working in nonprofits and other institutions would be really helpful, and help them, you know, think about their journey, how they got there.
That's a great idea. You know, one thing we've thought a lot about is how you can do that without overwhelming the mentor, right? Because if we all 240 of us wanted to become mentees of Dr. Mancuso, we would overwhelm her. But really how you can spread out that hub, and how even now we are all a little connected to her, but what other resources might Dr. Mancuso have, and being able to connect us to other people and really sharing that network, right? Remembering that it's not all a single node, but that we have those opportunities. Okay, Victoria, do you want to speak? Everybody, all of the groups are just coming up with such different things that it's really exciting to see this. So Victoria,
I think that a lot of the colleagues have mentioned, and it came out of a lot of the small group discussions. I think one of the things, because we sort of broke it down into what could be done at an institutional level and what could be done at a program level, whether that be department or academic program. And so I think that our group also mentioned sort of if you had an institutional structure, and I know, for example, your Department of International Health does, but it's for faculty only, and junior faculty like research associates aren't part of that structure. So if you had a more institutionalized framework, then it not only promotes equity, so it's not like, why do you have a mentor, or how do you get to meet with somebody once a month and I never see my PI or something. And then the other one was, to sort of standardize it in some way so that people could benefit. And lastly, to promote the fact that those are important as to sort of create this culture, do sort of make all of the meaningful changes people are talking about, is that if those grassroots efforts, or if there's a faculty member who is spending a great deal of time doing that he or she be recognized, because the way the structures are now, it's kind of people do it on their own time, and it is not part of a structure and it's not recognized. So all of that has been mentioned. Thanks.
Thank you. All right, Dr. Mancuso, I'll have you go last, and then we'll just wrap up and talk about next steps. Oh, you're muted, Leslie.
Somebody, I'm muted by the host there.
You're good.
Host, I couldn't undo it. We had a great group, and I would say a lot of the ideas are really good that I'm hearing. I mean, it inspires me, and I'm going to be thinking about this. One person in our group also talked about opportunities she's gotten, and I thought this was good for any of us that are here listening, is that her mentor, essentially, or one of her faculty that always went to certain meetings, had her now start to go to those meetings. And I think it proves something for all of us to think about, is what are the things that even I go to all the time that I could be having someone else step in and start the helm of that. And I did that with the women's leadership. I no longer want that with the World Trade Center. I moved that over. But I really think that's something for all of us to think about, is how can we get people in that position? I think other ideas were, some of them talked about taking people out for coffee, that they have done that. And I said, what's important is take people that are not necessarily also in your same field of expertise, but look outside that field of expertise. And so somebody said, how do we know what's going on in the university? Like, you talk to us about going outside the bubble. And I said, with the Carey Business School, I'm sure there's great talks going on. We've got to figure out how we can make sure people are able to access and go to some of these that they wouldn't know about. Because again, it gets them out of that bubble of and gets them into thinking in a different way, which I think is really important. And that's
great. Thank you so much. So thank you all, for all of the groups, for sharing your ideas. Thank you to the facilitators for writing them down and sharing them with us. One of the goals, again, from this seminar series is to really compile these strategies from women around the world who are in these fields working on these issues, and be able to share them and hopefully do something really concrete with them. The session was recorded. We'll have a link posted to the Center for Global Health website. We'll also be reaching out to all of the participants for a short evaluation, and we'll share all of the resources that we've developed here. There will be another one in the series. We don't know when yet, but the idea is really to be able to continue to expose people to different types of non-academic careers from women leaders around the world. So I'd like to thank again Dr. Mancuso for her wonderful talk, all of the participants for being here, facilitators again for a wonderful job, and for taking this time out of the day. So thank you for such a fantastic session.
Thank you.
I'm thinking, Megan, maybe you can end the meeting.